Are we ready, Brenda?
Yes, ma'am.
All right. Good evening and welcome. Thank you to everyone on our YouTube live stream for being here tonight. I call this meeting of the Montgomery County School Board to order at 7 p.m. on February 2nd, 2021. Thank you, everybody, for attending. Please stand for the Pledge of Allegiance. Hold on, we're waiting on the flag. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I don't need it. I'm just saying I did.
Right. Thank you. Our next item is the adoption of the agenda. May I have a motion to adopt the agenda as presented?
So moved.
Second.
Thank you. All those in favor?
Aye.
Aye.
Aye. Any opposed? We have an agenda. Dr. Meyer, I'll turn it over to you for your announcements.
All right, thanks, Ms. Graham. Yeah, just a couple of announcements. One, vaccinations. Our staff, they're scheduled for their second doses, and we're real happy about that. And we're still continuing to work with staff members who did not receive the first dose too. So we're still working with the health department to schedule those for them. But the health department's been a great partner with us, and we really appreciate what they're doing for our staff and helping us get in our employees. Next, athletics has started, competition has started. Some of you all have subscribed to the actual live stream, and we had a few hiccups at first with that, but it's working, I think, well now to be able to go and watch through the NFHS network. You can watch all of our games, and so I'd encourage everyone out there to tune in and watch our athletes play from home. So it's been a lot of fun to see that. That's it.
Thank you so much. Now it's time for public address. At this time, at each of our regularly scheduled meetings, the school board sets aside up to 30 minutes for residents, students, and employees to address the board about issues pertaining to public education in Montgomery County. Each speaker is allotted 3 minutes to speak. Ms. Drake will have a timer on the screen. As a reminder, the board does not respond to speakers during public address. We currently have 2 people signed up for public address. The first is Lori Roop.
Hi, everybody. My name is Lori Roop, 506 Switchback Road, Christiansburg, District D, Ms. Bond. Good evening, Madam Chair, Madam Vice Chair, distinguished board members, and guests. Thank you for allowing public address during virtual meetings. This is the first time since March 2020 I've been able to address the board publicly. I'm coming to you this evening to discuss questions that I have regarding the recommendation of changing phases and levels at this time. It comes as no secret that my children are remote for their personal safety as well as other family safety. In recent news, we've seen adolescents contracting COVID-19 has risen 12%. I understand the importance of children receiving quality education over quantity. Most of our children are in school right now, and I would like to see my children return to the buildings only when it is safe. Our students are not vaccinated, and our secondary students are just as likely to carry and transmit COVID as adults. For many of them, they have parents and grandparents who have not yet been vaccinated. And given the slow rollout of the vaccine, they may not be vaccinated by March 8th. I'm encouraging you to wait and see how well the vaccine rollout is going to protect our students, their families, and as well as our community members. We've been in this pandemic for 11 months. It's hard to believe. Implementation plans should have been made by now. As released on board docs, the timeline for this proposal tonight is a recommendation tonight, followed by information to be given to our board members in the next meeting, which will be primarily focused on the budget. A vote is scheduled a month away. How is that enough time for our board to see the whole picture, schedule included, before a vote can take place and allow for adequate public address? Thank you all very much for this evening and having this opportunity.
Thank you. The next person we have is Meredith McCree.
Hello. Can everyone see me?
Yes, Ms. McCree. Can
Okay.
you state your name and address, please?
My name is Meredith McCree. I live in Blacksburg, Virginia. 1501 Nelson.
I think we can only see your bed.
Oh,
We can't see your face. Now we can.
Oh,
Okay.
hi. Sorry.
Good. Thank you.
Thank you.
I
Good
only see
evening.
the timer.
I only see the timer.
You can
Now
go
I
ahead and
see
start.
you.
Okay. Good evening. I mostly just wanted to speak today to say that while we're very excited for our teachers being vaccinated, that this is a huge accomplishment, this does not protect our students or their families, some of whom are high risk for COVID. I was born with an immune deficiency, and my husband and I are both in group 1B for vaccines at the very back of the line for 1B. We do everything curbside. We work from home. But the biggest risk we take is sending our first grader to school. He struggles with remote learning, and we have been very happy with our decisions so far. We have loved hearing him read this year. We are so grateful to his teacher. But we also need to stay safe for our child, and that is only possible if our child stays safe. With new COVID variants arriving, we need to increase our mitigations, not decrease them. These include considerations for full social distancing, fresh air ventilation, COVID screening tests, and no indoor dining. I am not sure plexiglass sheets will be effective against aerosol spread. If we are planning to open schools full time before our students and high-risk family members have been vaccinated, we need to utilize all mitigation options or leave the school schedule as is. Nothing has changed for students and parents. Only teachers are protected now. Thank you for your time.
Thank you, Ms. McCree. At this time, public address is now closed. Payment of the bills. Do I have a motion to approve the payment of the bills as presented?
So move.
Second.
Second.
Thank you. Any discussion? All those in favor say aye.
Aye.
Aye. Any opposed? And the bills are approved. All right. Now it's time for board member reports. Does anyone have anything they would like to talk about?
If nobody's going, I will just briefly say that I've been attending weekly General Assembly updates on Fridays done by WSPA, and they do a great job, and I find them very useful. And also, I know Ms. Graham attended as well, but Monday and Tuesday, I believe last week, we attended the Capitol Conference and we talked to Delegate Rush. So that's my report.
Thank you. Does anybody else have anything? No? Okay. I just wanted to say thank you to all of our school counselors. This is National School Counselor Week. We know that your job was already hard, but the pandemic is going to make it even more difficult. So thank you for guiding our children and addressing their public health, their mental health needs. As Ms. Karan mentioned, as Guden Karan mentioned, I also attended the VSBA Capitol Conference, and our meeting with Delegate Nick Rush was, I felt like very productive. I'm excited about the options of offering more 3 and 4, well, new 3-year-olds into our schools and more 4-year-olds. So I hope that the allocations have changed a little bit and we're able to get more of those students early. Also, I'm hoping that the teacher raises goes through. We're all hoping for that. Of course, that only means the SOQ positions, and MCPS would need to be able to fund the rest of the raises. So I'm hoping for a very good outcome of the governor's budget and some of the new things that they put in place to support public schools. That's all I had. Next, we have our employee presentations for the budget.
All right, thank you, Ms. Graham. An important part of our budget process is hearing from our employee groups about the proposed budget. Ms. Drake will call up the speakers to address the budget proposal.
Thank you, Dr. Meyer. First, we have representing the nurses. We have Kimberly Moyer.
Good evening, school board members and Dr. Meyer. My name is Kim Moyer, and I'm happy to say that I'm a school nurse from Harding Avenue Elementary. I'm speaking to all of you as a representative of our 20 full-time Montgomery County school nurses and 1 full-time float nurse that serve our schools. Since the last time a nurse representative spoke at the school board meeting, we've all had significant and drastic changes to our personal and professional lives, with our traditional school year ending abruptly last March due to COVID. There are many new procedures to figure out and new roles to fill. The nurses were asked to finish the 1920 school year as screeners for the cafeteria workers, bus drivers, and bus aides, who prepared meals and delivered the food throughout the county. We were assigned to various schools for various shifts to ensure the safety of the staff in the new world of COVID prevention. Things that were new to everyone, such as social distancing, mask wearing, and symptom screening questions. Quite simply, we did our best to educate ourselves on the virus with the most up-to-date information and to meet the needs and assignments given to us by the Montgomery County School Administration. When our 2021 hybrid school year began, the nurses dedicated themselves to keep our schools clean, safe, and COVID compliant. One of our most important and time-consuming tasks, especially in our larger schools, is keeping accurate and up-to-date COVID tracking charts for our individual schools. These charts are vital to keeping track of our students who have been exposed to or contracted COVID. We track the exposure dates, testing dates, symptoms, the last day in attendance at our school, test results, and any other sibling relations at other MCPS locations. We also track the return of the school and the clearance dates if the person is an in-school student. As you can imagine, this takes frequent and vital communication between our nurses, families, and the VDH. The nurses work closely with our school administrators, teachers, and our custodial teams by helping them target high-touch areas, possible trouble spots in the schools after reports of quarantining students. We work closely with Kelly Hager, our nurse supervisor, who communicates with the local VDH to clear students to return to school or to help with more complex isolation and quarantine questions. Our deep commitment to the health and safety of our students and staffs drives us to work hard. Along with the COVID tracker, the nurses update flu and GI, gastrointestinal illnesses trackers at each school. Tracking has definitely taken a large part of our time and energy, but other important functions still must be completed and maintained. Kindergarten, 3rd, 7th, and 10th grade hearing, vision, and motor ability screenings in the fall were conducted with the in-person students with necessary COVID protocols in place, which lengthened the process, as did the appointments that were required for students who attended remotely, whose parents chose to participate in these screenings. We made individual appointments and we made for accommodating of the students in each school with COVID preventions always at the top of our list. The school nurses also maintain records of trained school staff to ensure the best care for all of our students beyond the clinic walls. education as needed for medication administration, diabetes management, and seizure first aid are all provided through our partnership with ProTrain. Ongoing support of our teachers and school staff is given through the training and skill checks for those needing to renew their CPR certifications as well. At the January 28th State of Virginia Board of School Nurse meeting, it was very satisfying to have MCPS school nurses receive a shout out from the board based on a comment they received at the state board's office. Quote, "The school nurses here in Montgomery County have gone above and beyond their nursing and guidance for our students, and I am sure the training has made an impact on how they approach the students," end quote. It is one small comment, but mentioned in the context of the state meeting, it was extremely satisfying. We frequently hear that in the United States, there is a shortage of nurses, particularly in schools, and many have proposed eliminating school nurse positions, but we feel that they're a very real and vital need to keep nurses in our schools. They need to be there to promote health, to offer care and support the students who experience chronic health conditions such as asthma, diabetes, and require daily medications. Our hope is to be that constant that can help guide MCPS staff through the normal times and be the extra support during these extraordinary times. Our goal this evening is not to ask for anything more than your continued support on our mission in our schools. Additionally, we'd like to express our gratitude to the board for approving a float nurse for the 2021 school year. This has been a tremendous help in the continuity of nursing care in our schools. We'd also like to thank the MCEA for advocating for the nurses to be able to participate in the VRS program and the board's approval of this valuable retirement tool for the 2018-2019 and ongoing school years. This has been a wonderful benefit for both retaining and hiring new nurses. Finally, we are most appreciative of the access given to the Moderna COVID-19 vaccine by our HR department and the VDH. We have already received the complete series, which is a benefit to not only us, but to our community. Gratitude is good for our health and good for our souls, and we have many things to be thankful for. Thank you for your time.
Thank you, Ms. Moyer.
Next is Connie Blows, representing the aides.
Good evening. I want to be first to start out to say thank you for last fall when you gave us the stipend. For many of us paraeducators, this helped to put fuel into our homes, buy the necessary groceries that we needed to get through the winter months, and also paid several medical bills for several of our employees. Second, we also want to thank that we was able to take part in the first shot of the Moderna that we took last month and waiting for the second shot. This has helped for many of us to know that we are able to take care and be there for not only our coworkers, but to be there for our families too. This evening, what we're asking for is to look at the possibility of starting VRS for the paraeducators. This is something that we've asked for over several years and have looked at, but because of budget limitations, it's always been taken off the table. We'd like for this to be looked at again. For many of us, we're getting near the time that we're going to be at retirement age, but we won't be able to retire because we do not have any type of VRS or anything to sit back on. The only thing we'll have will be Social Security. And as we all know, that Social Security could very well be gone within the next 20 years if the federal government keeps going the way it does. Another thing, we would like to say thank you for the 3% raise that we'll be getting in March, and for the raise that we are asking for this coming year, the 3.5 that Dr. Meyer has put into his budget. We'd like to say thank you for all the hard work that you've done during this time. We know it's not easy for you all to make the decisions that you've had to make. It's not easy for anybody. For somebody like me who has asthma, I have to be careful where I go and what I do, but I feel that my job is important to me. And I feel that the young people that I work with every day needs to have somebody there that is stable and able to do the job that we have to do. Thanks for all your hard work and keep up the good job. Thank you.
Thank you, Ms. Blows.
Next is Matt Fentress with MCEA.
Good evening. Thank you for allowing the MCA to speak and other employee groups, and also for supporting the stipend for employees and for approving the 3% raise for the remainder of the school year. It has helped with the financial burden brought on by this pandemic and has demonstrated your commitment as a school board for showing your appreciation for Montgomery County school employees during this unprecedented time. Montgomery County Education Association's mission has always been to fulfill the promise of a high quality education that successfully prepares every single student to their full potential. We believe that this can only truly be accomplished by advocating for our students and Montgomery County Public School education professionals. Salary. Our priority is for all current employees to receive a salary increase. Dr. Meyer has proposed an average of 3.5% salary increase for all employees, and we fully support this request. Based on the increasing cost of living and increased needs brought on by this pandemic, we wholeheartedly agree with Dr. Meyer that employee pay must be top priority. Teachers and staff need a significant raise every year, though, to be able to stay in this profession. Employee efforts during the pandemic deserve to be compensated by a sizable raise. As employees, we have adapted, changed, and educated ourselves in new teaching pedagogy. It is imperative that employee raises be reflective of the work and diligence that we as professionals have invested in for the betterment of our students during this world crisis. Montgomery County Public School now has a competitive scale that attracts strong new teachers. We equally need a competitive pay scale to retain the strong and highly qualified workforce that makes up Montgomery County Public Schools. Health insurance. We appreciate that Dr. Meyer and the school board in the past has proposed no increase in employee paid contributions for 2021 and 2022, and that this year there has been no increase either. In the past, increases in health insurance premiums have resulted in compensation decreases due to lower take-home pay. We agree that there should be no increases of the employee paid contributions for health insurance. And as just spoken by Connie, Virginia Retirement System, the VRS, the MCA believes members of all Montgomery County Public School employee groups should be considered for inclusion in the Virginia Retirement System. I personally know someone that's worked 30 years for the county, and when she retires, she'll have nothing to show for it. Most importantly, safety. The MCA implores that safety remains the priority of the utmost importance for our students and staff. The COVID pandemic has impacted all categories of employment, along with education. Current mitigation strategies that are in place have helped to combat school spread of the coronavirus in our community. We ask that we stay the course because there are too many unknowns when it comes to this global pandemic that we are all living through. Many are appreciative of MCPS's push to offer COVID vaccine to its employees, but no one truly knows how effective it will be, especially with the new versions of the virus popping up all around the world. We must remember that even though we have had the opportunity to receive the vaccine, our children, our students, their parents, their grandparents, and many others in our community have not. On behalf of members of the Montgomery County Education Association, we appreciate your continued support and dedication to the employees and students of our school system. We ask that you continue with your efforts to make a significant investment in your employees, because every time you invest in your staff, you are investing in our students. Thank you very much for listening.
Thank you, Mr. Fentress. Okay. At this time, Dr. Meyer, I'll turn it over to you.
All right, thanks, Ms. Graham. I presented my proposed budget for next school year at our last meeting. Mr. Krantz and I are here to answer any questions that you may have. You're scheduled to approve this funding request to the Board of Supervisors on February 16th. And basically these are the highlights of that presentation. I was proposing a 3.5% pay increase for our all employees, an average of technology, 600,000. We do buy Chromebooks every year. That's to replace 2 different grade levels. And that's the cost of that. That has never been placed in our budget. We always use carryover. Facilities and maintenance, 600,000. We've always been using carryover to maintain some of our buildings. Bus replacement, we should be replacing 8 buses a year to keep a solid rotation of new buses in the fleet. And I usually, we think 8 is appropriate, and that's 800,000. We did get behind some on that last year. Our total request to the Board of Supervisors and additional funding is $4.5 million. So what questions do you have for us? And you all can go ahead and discuss this.
I have a question, Dr. Meyer.
Yes.
I want to make sure that I understand the increases. When I'm looking at the teacher matrix, so we're saying it's an average 3.5% pay increase.
Correct.
But that doesn't mean that anyone's necessarily getting 3.5% increase, correct?
Who will get the 3.5% increase on the dot would be everyone but teachers. Teachers, it's going to vary according to where they are on the pay scale. It's going to vary between, I think we're only off maybe 1/10 or 0.2%.
No, I calculated it was more like at the lower levels, it was about 1.5%. And at the higher levels, it was only about 2.5%. So,
well, okay. So
no teachers are getting 3. I just want to make sure that we're really clear what we're communicating, because I think there's the impression that people, and they might be a little misled, that, oh, we're all getting a 3.5% increase, and that's not accurate. And I don't want to see on the, people saying, oh my gosh, they told us we were going to get one thing, but that's not what we're providing.
Yeah, and let me explain. That's why I say average of. If you're at the top of the scale, you're at the top of the scale.
But even in the middle of the scale, it's still, no one on that scale, on the teacher scale, is getting 3.5%.
Yes, they are. Yeah, we've got that. We've got those averages. In fact, Tommy, I know we looked at it the other day. There are several places on that scale where it's over 3.5% actually.
Really?
Yeah, you got to look. What you have to do now, you can't. Here's what you may be doing, Sue. You may be going across instead of diagonal.
Oh, okay. I see what you're saying.
You know what I'm saying?
Mm-hmm.
Where if you're on step 20,
you're going to go up 1 to the next step.
Correct. Step 21 is 3.5% more than step 20.
Gotcha.
Yeah, that's why that is a confusion of some. You can't go side to side. I mean, you got to go to the step that you go to. Yeah. Does that make sense now?
Yeah. It's still not 3.5, but.
Well, most are. Most are 3.5%. What's that, Tommy?
I mean, most of your steps are about 1.5%, just going from one year to the next year on average.
In fact, that's on a current scale.
Right.
In fact, something Matt was just talking about is that the highest raises are actually where we're behind in the middle of the scale, where we're behind Roanoke County. That's like, I think some of them, I don't have it right in front of me. I do have the calculation on what every step percent to the exact amount would be. But some of them are like 4% or more in some areas. And so, but I can give that to you.
Okay.
And give you that.
Mark, can you explain the diagonal thing again? Because if a raise is not given, wouldn't every teacher move up a step anyway? We're not.
Yes, that's what I think he was trying to explain. So, for example, if you were at a step 20, you would go up to a step 21, And so you have to look at what you're making a step 21 less the 20 and then figure out the increase. I was just looking from as Mark said, across.
So Mark, basically you're on step 20 this year on the current scale. We're proposing a new scale. If you don't skip step 20, you go to step 21 next year of the new scale. So step 20 of the old scale to step 21 of the new scale is going to be 3.5%, give or take tenths of a percent, basically.
So when you say 3.5%, that actually captures it partly captures the step, and it partly captures the new increase. Is that correct?
Yeah, but there's always been confusion. A step is not always guaranteed. This year we did not have a raise at all the first half of the year. So actually the steps backed up to the teacher. Where so same scenario here. If you were on step 20 last year, you were moved to step 21 this year. But the new step 21 this year was the same as 20 was last year, because basically you didn't get a raise at the beginning of the year. There's no automatic, you get your step. That is not automatic. We don't have money to give a raise, then you don't get a raise. Does that make sense?
Yeah, it does. It is a little bit confusing, I guess, on the, when we throw these numbers around on adjusting adjusting our scales, right? Adjusting our steps so that we can be more competitive, right? But my understanding is that we attempt to move everybody up a step each year. Is that?
Absolutely, yes.
And does that, talk to me a little bit about the funding on this. Does that usually come all from local funding, or does the state, when the state gives us money, is that part of, because I know sometimes the governor will say, I want to give a 2% raise or a 3% raise or a 5% raise or whatever, and then he gives us that money for the SOQ positions. So how does that, can you explain to me how the state money plays into this?
Yeah, correct. Well, simply stated, the state doesn't give us enough money, and the county ends up having to foot most of the bill. With a raise, I can give you an estimate of state money will account for about 46% of the money that will go towards a raise, and the county will have to fund about 53% of that raise. So when the governor says, "Hey, I'm going to give a 2% raise," we're not getting he's not giving the school division all the money for the 2% for all employees. In fact, only about 43% of our employees are SOQ positions. So what the state is saying, that SOQ, meaning standard of quality, that we can run our school division with only 43% of the employees that we actually have, which is ridiculous, because it's not the case. We could not cut over half our employees and still run the school division. And so that's an issue with how calculations are done at the state level. So what happens is when these types of proposals are made, it puts pressure on the locality to have to come up with the matching money, because we do not necessarily, when 43% of our teachers are SOQ positions, we do not classify a teacher as you're the SOQ and you're not, and another is not. That's not how we just, a teacher is a teacher. We do not classify if you're SOQ or not. The state usually funds less than half of the raise that they say that they're giving to us.
So this year is, there's a certain amount of money we may get as an increase from the state, but that's not necessarily for a raise. What Ms. Graham was speaking about earlier at the Capitol Conference is this hope for a 2% raise. Is that worked into these numbers, or would that be an additional help if it came through from the governor?
Yeah, they are. This is worked into those numbers. The first 2% of this raise of the 3.5% is where basically 46 46% would come from the state on the first 2%. The last 1.5%, it would have to be totally from us or from the county. Does that make sense?
Sorry. Yeah, I think so. Okay, so what is the approximate cost? Because I'm assuming at some point on your scale, you do have teachers at the upper end of the scale that end up retiring, and then you end up hiring new teachers maybe at the lower end of the scale. What is the cost of basically moving all the teachers up a step each year?
Well, keeping the same scale?
Keeping the same scale. Do we have a number for?
Yeah, if we didn't change the teacher scale and everyone goes up a step, it costs about it's about a 1% raise between steps. Okay.
It was about 1.5 when I calculated it.
Yeah, I mean it varies from step to step. Of course, in the bottom, it depends on the step. Of course, at the bottom, 0 to 2, there's none because it's the same pay, and so but it costs us $1.2 million just to give that one step. That's why I say if we ever don't have the $1.2 million, we can't give a raise at all, and you can't really go up to that step.
Okay.
So.
All right. I'll let others jump in here.
I was wondering, Mark, the other day reading the Dr. Meyer, Mark, reading the article about the county and expected revenue and revenue drop and things like that. So they're estimating $800,000+ revenue. So what do you think our request, how much we can really get from that 4.5 million, how realistic that is?
Right. I guess it's one of those things. It's going to be the will of the board and what you guys ask. But yeah, they have $800,000 in additional money, and we're asking for $4.5 million in additional money. So that doesn't really come close to adding up. Usually they've been giving us between 40 and 50% of our additional money, of their additional money. And so, in looking at that, if that were to happen again this year, you're looking at between, $400,000 to $500,000 that we would actually get. Pretty much I put this budget together based on needs. It's a needs-based budget. I mean, I want to show our folks in our community, this is what we need, but we're not being funded it. And so, we need, our employees deserve a 3.5% raise. We need to get competitive with Roanoke County. That is sort of the next step. Roanoke County there's a competition in terms of recruiting of teachers between Roanoke County and us. And I would like to see us pay more than Roanoke County does to their employees. Secondly, we need, we obviously we've shown that this year Chromebooks are very important to educating our students. That has never been placed in the budget. We've always used carryover year-end funds for that, and so that needs to at some point get into the budget. Maintenance cost. Tommy has talked to you all about how underfunded the maintenance of our buildings are. And so that is something that is definitely a need. School buses, if we don't replenish school buses every year, then at some point it's going to cost us a lot of money down the road to replace a lot of them at one time. And again, that is not in the budget. It ends up, if we have funds at the end of the year, that's how we've been purchasing school buses. And I mean, technically, these are things that we have to have and need, and I believe that they should be actually in the budget.
I mean, I totally agree.
Yeah.
On another note about the SOQ positions and 132 school divisions we have, none can actually run a school with the SOQ money that is given by the state. So there is a bill, actually, I can't remember the bill number now, but to look into this SOQ position and SOQ funding in general. but VSBA was worried that when it comes to the finance committee, I think it passed the committee, initial committee on the education, and I think that they were saying when it goes to the finance committee, because the price tag is going to be so big, it may not go anywhere. But I think at one point, hopefully, members of the General Assembly will understand that these are serious needs, and then they have to do better funding.
Absolutely. And I'll give you the exact number. I gave you a percentage. We have 1,670 full-time employees in Montgomery County Schools. The state only funds 731 employees, 43%. And they call that SOQ, standards of quality. I would say that's standards of inequality or no quality. I mean, we couldn't run the school division, and we have a quality school division, but we would not be if we had to reduce to what just what the state funded us on. That's for sure.
Anyone else
Goonan,
have
are
any
you
questions?
finished?
Yes, I am. Yeah, I am.
Okay, so I absolutely agree that what the state does in only funding SOQ positions is ridiculous. And I don't understand why someone hasn't they haven't called themselves on this one, because they want to say that they are fully funding education, but they're not. Because as Dr. Meyer said, it takes so much more than the few positions that they fund. So I absolutely agree with the raise, and that the technology that we have been able to provide for our students in Montgomery County, as far as putting a device in every student's hand, is just amazing. Talking to folks across the country and what's going on in their school districts, there's some households where there may be 2, 3, 4 children, and there's one device that goes to the household. As difficult as it has been for folks in our district to try to help support their children on their devices, at least their children have a device. And that is because of the commitment to this board for many years, making sure that happened. And then as we went into this pandemic, understanding we still have some children we need to get devices into their hands, and we did that. That's just amazing. And figuring out how we are able to provide them with the best service as far as internet, so that they can be able to use the devices. Again, we may not be at 100% every time, but we have done some amazing things to try to ensure that that happens. And part of that is with our school buses. So if we didn't have those buses, I have been here when we couldn't have school because we couldn't get enough buses to start. So making sure that we stay on schedule with buses is just critical. So I've always said we need to do a needs-based budget. So I was thrilled that this year I saw a needs-based budget, and I didn't have to raise the point. Why are we not asking for what we need? So there is at least one more area that I believe that we should be including. And it became very, very apparent that our aides are a key part of our operations. When meals were going out, when there was extra support needed to cover classrooms, to do all the things that, quite frankly, many of our aides were not hired to do, but yet they were there doing it. And then we say, it costs too much for VRS to help support them for all their many years of service that they give us when they leave us, is just wrong. So I believe we should include VRS in this budget for our aides. We also know that the turnover, with how high that is with our aides, and this is one of the reasons too. So if we're going to do a needs-based budget, then we need VRS for our aides.
Okay, so Mr. Kranz, we had that calculation. Do you know what that cost is?
Unfortunately, no, sir, I don't, but we can pull it together real quick.
I think it was 1.1 million last year.
I was thinking 1.112, something like that. So
last year, yeah.
I think that may have had other groups in it besides just the aides. So I need to go back and check.
Oh, okay.
Okay. All right. So yeah, check on that, and if it's the will of the board, we'll be glad to add that to y'all's budget when y'all approve it. And so, would you all like for me to do that? Go back and
I support.
Okay. So a straw poll here.
Absolutely me.
Right. Penny, Marty. Do I have one more thumb? Okay.
I agree.
All right.
I support it.
Oh, that was 7.
All right.
I as well.
Thank y'all. Yeah, I agree 100%. Years ago, our school division chose for some reason not to include, well, I know the reasons, it's funding, aides in our VRS system. And it is definitely something that's important that I think is deserved by them also. There are divisions around us who have included aides in VRS. And so, so we will add that and bring that back to you as an add-on for February 16th. Okay.
Thank you.
Yes, ma'am.
Does anyone else have anything on the budget? Okay.
So just for me, a note of feedback on this. I feel like this is kind of, we revisit this point, I think, in different years, and I would like to see us maybe get more consistent about it. I think that when I came on the board 5 years ago, we did push pretty hard to have a needs-based budget that basically threw everything that we actually needed, like Ms. Franklin was saying. And I do think there was maybe a year or two that I think, based on your recommendation, Dr. Meyer, that was basically pulled back a little bit to make it a little bit more, realistic. We do have a relationship with the Board of Supervisors. That sometimes comes into play. So, I definitely think that we should somehow advertise those needs, but then, I'd like to get as much money as we can for the school systems, and I just think we need to think about the best way to do that. One of the things that when I looked at, because I wasn't here at the last meeting, when I looked at that presentation, I think there was one of the bullet points was quality educational programs. One of the other things, which obviously includes a lot of the things that we're talking about here with pay and other things, but we've also just gone through this whole thing with the strategic plan. I know there's going to be a lot of things that have come out of that are going to be coming out of that are going to need funding. I guess I start to look at, and maybe this is a conversation that we can have when we find out how much money we're getting and where the priorities are. I mean, I certainly agree with Ms. Franklin that the technology, the buses, those are pretty high priority items. I would very much like for us to do everything we can to give at least the steps when we can, and to take advantage of any state money that comes for raises. But for me, as we go through this year after year, I would like to see more more things coming to us for certain programs, for certain things that are coming out of the strategic plan. I mean, that we involved so many people in the community, and I think that when you have some programs, maybe something exciting that comes out of that the public is behind, I think that could also help, drive more, more revenue to our school system. So that was some of my thought on this. I do agree that, we do need to stay competitive on salary. I've said this before. I think that to some degree we need to, if we're asking for roughly, I think maybe about $2 million of that raise money is to bring up competitiveness with Roanoke City and the city of Salem. I think we need to back up what we're saying is our needs with numbers. I still don't see anything about attrition rates, what the average is, what that type of thing. I don't, how many people are we losing to Roanoke? I mean, when I look at the numbers for the Roanoke County, and you divide those out over 12 months, I think we're pretty competitive with Roanoke County right now, actually, and we're certainly more competitive than a lot of the counties around us. I don't think Giles was even on that list. So I don't want to advertise that we're somehow uncompetitive, or because I think we're doing actually a great job, and I think we've given a raise or done something with adjusting salaries every year that I've been on the board for the last 5 years. So and I also think that there's other ways, when we talk to teachers, even the employee groups, things like that. I'm glad that Mr. Franklin brought up, I know that for the nurses, that VRS thing was a huge piece. And so I think to go back to the employee groups, see the types of things that they want. I think a lot of teachers who have aides, and then, we can't keep the aides and things like that, helping them might mean, hiring more aides or giving aides more money so that there's more stability or something like that. So anyway, I'm not against any of this stuff. I think it is all good. I'm maybe being just a little bit more circumspect about how we prioritize things and how we present it.
Thanks, Mark. And to respond to a couple of your thoughts, the teacher pay increase is a big part of our strategic plan. Retention and hiring of employees. That was an entire area that was led up by the instructional committee. That was a huge piece. We're trying to get competitive at all parts of the scale with Roanoke County. Roanoke City and especially Salem, we're not even close in most steps. They're outpaying our teachers by $4,000. I mean, it's a long ways to go to even get close to Salem. Luckily we've got our starting salary where it needs to be, but like Matt said from MCA, that we're getting them in here now we need to keep them and make sure they don't leave and go to Salem for $4,000 more. Because a lot of folks do drive here from Roanoke to work for us, and so so I think it's important to keep. I mean, if you look at where we started, oh my gosh, we've gone we were number 7 out of 8 school divisions in teacher pay. It was, 3 years ago, and we've really done a good job at making that work and happen. And because it's getting more and more competitive, fewer and fewer folks are going into education, and it's harder and harder to find folks to actually teach for multiple reasons. And so, but one thing that our employees appreciate is a salary increase. But in the future, maybe we let them, ask teachers and, act like you're saying, what they prioritize, what would they want first when it comes to a list of items. Would it be more people helping them in the classroom, or would it be a salary increase? And so we'll definitely take that into consideration later on. Something else too, that this is a needs-based budget. Something that we've talked about, and I like to encourage us to talk about when we have our meeting with the board of supervisors, is looking at a revenue sharing agreement where basically, you've got most of the school divisions, Roanoke City, Salem, Roanoke County, they have a revenue sharing agreement where basically, they know what they're going to get every year, any percent at a certain percent of what is the added funds. And so they really don't have to go to their governing body to ask for the money. I mean, it's just, okay, this is the increase in funds. The agreement is you get 50% of that increase, here it is. And so, we're going to have a joint meeting with the Board of Supervisors on, I believe, March 16th. And that would be a great thing for us to start talking about as well. So it's not this, we don't know every year, and we can work a little bit of ahead of things if we know how much we're going to get. So.
Is there one other question, Dr. Meyer? I saw the 21 additional positions unfilled as a credit in a line there, but are we not adding any positions this year?
No.
Or is there a chance to add any of those from, lapse? Would it be lapse money or yeah?
Yeah, basically, if we end up adding any positions, because we may need to add positions due to class sizes or just, division needs. And that's what we're going to hold on to the lapse money for. And that's the money you were talking about earlier. So that money would be used if we do need to add positions in certain places.
Okay.
Yep.
I'd also like to see us at some point, I know there's needs that have come up, but one of them that's come up several times in the last few years is more GRTs, I believe. So I don't know when we can make room for that in the budget, but I'm looking forward to the day when we can do that.
Does anybody else have anything? Okay.
Just one comment in response to Mark's comments about being competitive. So you have to remember, when we're asking for a 3.5% to make sure we're at least staying where we're at as far as pay, everybody else is going to be asking for funds too, so that they can increase the benefits, the compensation to their teachers who are, as the superintendent said, getting harder and harder to find because folks aren't going into this profession.
Absolutely. Yeah, we're not the only ones go looking for raises. And, when I gave those comparison charts in the presentation, we were comparing what we hope to be compared to where if they were to not get a raise at all, which is not going to be the case.
Right.
Yeah.
Right. Anyone else? Okay, Dr. Meyer, I think the next agenda item is yours as well.
Yes, it's the COVID data presentation. Mr. Garrettson and Mr. Knott are here to provide an update on regional data and employee absence data. Whoever's first.
That would be me. Good evening, everyone. Just wanted to give you an update on athletics. Moving into the postseason play for our winter sports, which were played first this year, we're not going to require masks while competing in postseason play, but we will ask and have our teams wear masks at other times, including practice. The rest of this slide is a little bit busy, and I apologize for that, but I wanted to give you an idea of when teams were playing in the most current tournaments. Both Auburn and Eastmont will be playing in their district basketball tournaments and their other district tournaments this week. BHS and CHS did not have any district tournaments. They'll go straight into the region, and then that begins next week for all 4 high schools. Next slide, please, Brenda. So, nope, one back, I'm sorry. There we go. So fall sports begin Thursday. Hopefully the snow will be gone and the weather will be a little bit better, but they start Thursday, and also the 15th. Football starts Thursday. Other sports start on the 15th. Competitions begin on the 26th. Outdoor sports include football, golf, cross country, and we're going to move forward with competitions as scheduled. So these teams will be playing their athletic district opponents. Football is going to have the face shields on their helmets. Those came in today, and our coaches will be getting those put on the helmets for the student athletes. We do believe that outdoor sports is the best environment that we can have kids participating in because they're they're not indoors, not breathing the same air, not potentially breathing the same air, and will help as one of the mitigation factors that we will be looking at to help prevent us from contracting any sickness, illness of any kind. We're not going to require masks while competing golf and cross country either. They'll be staged in cross country where they won't be running in packs as much, and in golf, they can certainly distance very easily in golf. In our indoor sports, and I do want to apologize to our competition cheerleaders. I did leave them out last week in the presentation, or 2 weeks ago in our presentation. We're going to move forward with competition at all levels as scheduled as well. Because they're indoors, volleyball will wear masks during practice and competition. Like I've said before, one of the mitigation strategies is not to switch sides, which is normal in volleyball, but this year we're not doing that. In competition cheer, they won't be wearing masks when they're competing, when they're in full practice, but at other times they will be wearing masks. And we'll use the same types of mitigation that we had planned for winter indoor sports, such as between JV and varsity volleyball, clearing the gym, cleaning the gym, and then bringing the next group in, the varsity group in, to compete. Next slide, Brenda. We also have some fall activities. We have theater, forensics, and scholastic bowl, and we have mitigation strategies in place for all of these. One of the things with theater, the judges, and when they're judging theater competitions this year, will certainly be allowing for distance between the characters in the performance, understanding the need for that. A mask will be worn by our participants. They will social distance in all of these. We'll have multiple rooms set up for forensics and scholastic ball, and may even compete virtually in some of these, as the state tournaments in both of those will be virtual tournaments. Next slide, please, Brenda. And this brings you to Mr. Garrettson.
Thank you, Danny. Good evening, Chairman Graham, members of the board. I believe we planned back in December to come back on this date and share some COVID data. Of course, we've continued to do the weekly updates that are shared with board members on Tuesday. Those are also published on our website. Ms. Drake posts those each Tuesday as well. So you've got kind of that running feed of information. So I have just a couple slides tonight that I'll share, and these should go pretty quickly for you. Up to this point, as of today, we've provided public notification for 155 positive cases in our schools. Those are lab confirmed positive cases, again, with some potential for exposure within our schools. So that number is 155 current as of today. Of course, over the last several weeks, we've been doing a weekly breakout of those numbers between staff and students at the board's direction. So as we stand right now, that 155, 90 of those are staff members, 65 of those are students, and we give you that percentage breakdown as well. We continue to work with New River Health District, and of course, they're responsible for our contact tracing, as we've discussed. They continue to report that they do not see any evidence of substantial transmission within the school setting. We've talked about that at a couple other board meetings as well. Again, that evidence of substantial transmission, we have discussed how you can't be 100% take that to the bank. But again, the aspect of they're not seeing that in their contact tracing for us. Again, no reported outbreaks within the schools, and particularly for our health district, that's not just Montgomery County, that's the surrounding schools as well. I believe that's the next slide, Ms. Drake. And this one can go a little quickly because Dr. Meyer mentioned a lot of this in his opening. Of course, we're very grateful to be provided the opportunity for our employees to receive the COVID vaccine. We've scheduled multiple occasions so far as a Virginia Group 1A, that's our school nurses, and Virginia Group 1B, that's pretty much the rest of us who work with the schools. We did modify the school schedule back in January, the week of the 11th, to allow greater flexibility for our employees to make their appointments. Again, these are all voluntary. No employee is required to take the vaccine. It's their option. And we did have over 1,500 first dose appointments for MCPS. And again, we plan to come back later this month and get all those who had first doses, second doses completed. And as Dr. Meyer mentioned, we continue to pick up smaller number of folks who, for whatever reason, whatever circumstance, have decided now that this is something they would like. We continue to make first dose appointments as well. And I believe that is my last slide, Ms. Drake.
So this is our substitute fill rate, and you can see that back in December, our unfilled positions was very high. Since then, our numbers have stabilized. Part of that was due to the schedule change, but we have also seen a decrease in the number of our staff members who are having to quarantine, a significant increase. As of today, we're back into the early October numbers, very similar numbers as to what we had in October as far as needing to quarantine because of possible exposures. Right before the board meeting, I got several emails from employees who let me know that they had been cleared to return and will be able to come back as of tomorrow. So, right now, from an employee standpoint, we're doing very well as far as COVID and quarantines go. Our fill rate since January 4th for substitutes for teachers has been 96.7%. And since January 4th, our fill rate has been 66% for our aides. This is a little bit lower. Last year in January, we were right at 72% for aides. So we are a little bit lower, but I don't think it's significant compared to last January in this time period. Next slide, Ms. Drake. We continue to average somewhere around 5 to 10 custodians and 8 to 10 bus drivers absence per day. We have been able to fill those positions with either substitutes or from within, either in case of custodians, providing overtime to make sure our buildings are clean, or use of subs. And with bus drivers, again, we've been able to fill those as well. Next slide, Ms. Drake. And this is yours, Dr. Meyer.
Yes. All right. Thank you, Mr. Knott and Mr. Garrettson. As Mr. Knott just talked to you about, we've seen an increase in employee attendance, an increase in the sub-fill rates. We're excited about the ability of our staff to receive the vaccine, and also our community data is starting to trend in a positive direction. Based on this, I like to recommend that the board consider moving MCPS to phase 3, level 3, beginning March 8. This would mean all students would have the option to attend full day in person. Remote instruction will continue to be offered to students if they would like to remain in a remote setting. Our parents will have a choice through the end of the school year, as to what they want their setting that they would like for their child to be in. I know there are a lot of questions, and so what this would look like. So what I'm asking is that at the February 16th meeting, I would like to provide all of you with the logistics because there will be a lot of questions. And if you have any specific questions for me, please just forward those questions to me so we can make sure that they are addressed. We're going to move that meeting on February 16th from the PD Center back to our regular boardroom because I'm sure there will be a lot of information that the community will want to hear during that meeting. Because at the PD Center, we really cannot effectively video that. So we're going to be in our regular setting. We're meeting with principals tomorrow to discuss the logistics. A lot of what happens, can be different from building to building, just simply because all of our buildings are different in the way things work. So, principals will be working together just to ensure that it all works out. Something else that we're doing is we're going to launch a thought exchange tomorrow with teachers to provide input from them. The exchange will ask this question: knowing that safety is our first priority, what information and mitigation strategies will help you feel safe with more students in the building. So we want that feedback from our staff so we can make sure we are addressing their concerns. Also, our elementary and secondary advisory committees will be meeting to discuss, as well as our health committee will be meeting to discuss this move as well. So we're going to be getting a lot of input the next 2 weeks that we can present to you on February 16th in order to ask you to consider voting on this recommendation on March 2nd, and that is to allow our students to attend all day starting March 8th. So a lot of the details will come at the next meeting, but are there any questions or thoughts that you'd like to talk about for now?
I have a question. You knew I would. I'm wondering, how are we determining how many students are going to be in the building? So you're saying that parents are given the option of in-person or remaining remote. What are we using? Are we going to do another survey and find out from parents how many are planning on sending their students and how many are planning on having them home? Because obviously the biggest concern here is mitigation and social distancing, and how do you put that, if more than 75%, even if 75% of the students come back, how are you going, if you have a class of 24, you've got 18 students in the classroom. So how will we know how many students are going to be there? And will we be allowing students to kind of come and go like we sort of do now? They're remote, then they're in person, then they're remote. And there's just, I have a laundry list of questions here, and I know you want us to just send them to you, and you don't want to discuss them now, but
yeah, I can, but go ahead and send, make sure we get that question down. I think Annie's keeping track of questions, but just a quick answer to that is we're going to base it on our current numbers. What we do foresee is a couple of things happen. You may have parents who will not feel comfortable at that level and take their kids out, but then I foresee us having, especially secondary students, who will go from remote to full day, simply because right now we're only offering 2 hours, and I've heard a lot of secondary families and students say, I don't see the value in going to class for 2 hours a day. So there may be it will be a sort of a moving target at first, and then we're still going to allow for students to go back and forth, especially if it's based on quarantine and that type of thing. Yeah.
Also, could you explain when you say hybrid? I've had several people come to me, and even principal, that we're not clear. So when we say hybrid, we mean that students are now going to be going full day, regular schedule.
Yeah. Correct. And
so a teacher will be teaching both students in front of them, which could be maybe 18, 20 students, as well as having students on the computer, and they also have to synchronously teach to those students.
Right, that's what they're doing now. I mean, the model is now.
Well, but they have a lot less students in the classroom. 18, and classroom management is a whole lot different with 18 people versus 5, 6, 7 people.
But if they end up with 18 in front of them, they shouldn't have but 2 or 3 online. I mean, most class sizes are no more in the low 20s.
But I use 24 as an example. So 75% of 24 is 18. So that's 18 kids in front of me. Okay. I mean, unless we have a lot less smaller classes than we've had in the past, we have definitely, I know plenty of people who teach and have 25 or more students in their classrooms.
It varies from school to school, as to how many.
But there are schools that will have that.
Yeah, absolutely. Yep.
So, these are all the things you see details are going to be provided, but you're just going to figure this all out and let us know what you've figured out. I would just like to know how we're getting more involvement besides just principals and teacher thought exchange. But I think that the people who are in the classrooms all the time really need to be involved in the decision-making process.
Well, yeah, and we, like I said, we're doing the thought exchange, and we're doing the advisory committees, which do have parents and teachers on those advisory committees. Your specific question as to how to manage a classroom with those kids in front of you and in the on the computer, they've been doing it. I mean, they've been doing it all year.
But that's not what I'm saying though. I'm talking about, yes, doing that with a whole lot more students. And now you have to maintain social distance and make sure, especially if you're, I mean, I'm thinking middle school kids and high school kids, boy, but elementary school, and having to manage all these students sitting in front of you and dealing with that, as well as some online. And I guess in elementary school, most of them they have separate classes now, but even in middle school, trying to deal with sixth graders in a classroom and having a bunch of them and trying to keep them socially distanced, and then also cleaning desks in between classes. If we're going to go to regular schedule, how are we going to make that happen? There's a whole lot of things that are going to change. So I'm curious to see how that's all going to look. I mean, you guys.
Well, I mean, it's going to look, and I'll say this: it's going to look different in every teacher's classroom. It's just like some teachers are, and most are excellent classroom managers. They're organized and they know how to manage a classroom, and I trust that they will do an excellent job with this.
So you envision a full 8-period day, like in the middle school and the high schools?
Correct. And we'll go over this in 2 weeks as well. What we're envisioning now, though, for lunch is basically about an 80-minute lunch period where students are assigned to a teacher, and it becomes a lunch/IE time, which is what a lot of the schools are doing anyway, where it's more of a rotation through the cafeteria and back to the class instead of having 3 set 30-minute lunches. And so that's one of the details that schools will work out as well.
I'll stop asking questions.
Yeah, I mean, there's a lot of things.
Sorry.
So I think it is important to note that this isn't just we're going with whatever schedule we have right now, and instead of only coming in the morning or in the afternoon each day, you're going to get to come both morning and afternoon. That this is a complete schedule change, right?
Well, I mean, it's pretty much
for this
schedule. It's a schedule that's a normal school schedule, with the exception of what happens at lunchtime. What happens at lunchtime is going to cut a little bit of time off of each of the other classes, but in a middle school, they do 8 periods. They will start doing 8 periods a day. Right now, they do 4 periods a day, so they'll go to all classes every day. In a high schools, it depends on what high school it is and the model. It'll be a regular school schedule.
Yeah, I understand that, but it's a change from what we've been doing, is my point, right? And I don't know if everybody understands that. Because honestly, the first time the proposal was made, I didn't fully understand that. So I have concerns on this in 3 areas. And I'll say that I'm actually, from the beginning, I've been predisposed to go back to this kind of a schedule because of the lost time. And, I feel like we tried a couple times, I think, in the fall to go in that direction, and it was met with resistance, I think, from staff and from parents, and I think that resistance, after I heard, I'm thankful for our community and our teachers who reached out and explained things to us, but where I thought we had left this back in December, at least mentally, I mean, I thought it was going to be very difficult to pull off something like this. Let's put it that way. I'm predisposed, I think, to seeing something like this happen. I just don't. I think there's going to be some challenges, and I'm not saying that I'm going to be totally against it or that we shouldn't do it or we shouldn't try necessarily. But I think for me, there are definitely still some. I mean, the 3 areas for me is health, the classroom experience, and basically how we go about doing it. And so there's a bunch of things under health. I guess we don't necessarily need to belabor them right now, but I do think we need to talk about them. And I think the classroom experience piece, I think, is just as important, because what happened, I think, when we tried some of the barriers and stuff before is, I mean, those classrooms, some of them resembled like a mouse maze experiment I did when I was in high school or something, I mean, and kids couldn't see the teacher. I mean, I heard about, that in some of the rooms that we tried it, kids came in, crying and there is, I understand what we're trying to do with the mitigation, but there, some of what we're doing has the potential to really change the classroom dynamic in a way that, I'm not a teacher, so I don't necessarily feel qualified to say, how it would change it and if it's something that we can work around. But I am concerned about that. And I think that I definitely on the thought exchange, that's a full-fledged thought exchange, right? Where people can just write whatever they want and stuff. Okay. Because I think you said something about asking a specific question about the health side of things, but I also want to hear about, some of the other concerns that were brought up the last time we brought this up. So, I do think if there is widespread support for something like this, that I could certainly be on board if some of those things were answered. But I think we're kind of a ways away from that. And when I look at that March 8th date too, I just wonder if we shouldn't be trying for fourth quarter or, who knows what. So those are some of my high level thoughts. I'll give other people a chance to.
And I can tell you, Mark, that we are going to plan. We have several classrooms right now that have been using for several weeks now the dividers. And, that is part of the plan to use dividers where 6 feet cannot be maintained. And so they are using dividers now.
Okay, so let me chime in with that because I was in some of these schools where the dividers were being used and there were issues with them. Some of the dividers don't come to the edge of the seats, or the edge of the tables. So when the students are sitting there, unless they're leaning in, they're not behind the petitions. The other ones, the smaller ones, teachers were saying having the children not move them around was an issue, constantly reminding them, don't move them, leave them alone, stop fidgeting with them. And in buildings like Christiansburg Primary, Harding Avenue, with the open concept, seeing chairs and desks pushed against the walls and moved so that they can accomplish some kind of distance between the students, which quite frankly is still not optimal. And then we're talking about putting more students back in, more of the petitions put up. I don't see how that is going to work when you have students who are having to come through a classroom to get to the restrooms, and that takes away even more space within that classroom. Plus you constantly have students going back and forth. I just don't understand how that can happen. Part of the reason why I think we are having so much, are having such low numbers and there's no, doesn't seem to be transmission going on within the buildings is because we're doing the things that we're doing. With the vaccines, yes, it makes things a little better, but we also have to remember what is going on with the variants of this virus and how much more contagious that they're saying they are. So I am most definitely at the point where I understand we need to get our children back into the schools in front of teachers for many different reasons. but there's still some safety concerns that I have as far as how are we going to do this and still maintain the level of safety that we have. Because in the high schools and in the middle schools, they're all much bigger spaces than our elementary schools. And I think folks need to walk into some of these elementary schools and see exactly how things are going. Some classrooms, yep, but that's because there's only 4 or 5 students there. Other classrooms, no. And because their spaces are not as big, it's more of an issue for the teachers. We have wonderful teachers who can manage a classroom, but it's a regular classroom. We are not teaching in regular classrooms when we have petitions up all over the place.
You know, another option too that, you know, of course, this is all coming next week, and it's good to have some of these conversations now as we look into some, you know, some additional mitigation is, you know, we could give teachers an option of some of the teachers' classrooms, they like the shields, especially ones with tables instead of desks, because the table ones are usually the plexiglass shields, and the teachers are seeming to like those. You know, an option we could give teachers is an extra level of mitigation, instead of the desk shields is actually, you know, of course they got to wear a mask, but we could do face shields. Face shields might be an option where they actually wear a mask and a face shield, and let the teacher choose to as to what works best in their classroom. You know, because from, you know, my understanding, the mask and face shields are rather effective in preventing the spread of the virus by using both. So that's an option that we can throw out there to teachers. And Tommy, I know we already have a lot of face shields. I don't know how many you have in stock, but we could probably order more if we need it. We could sort of survey teachers and ask which do they want in their classroom, the face shield or the desk shields. You know, as the extra level of mitigation. So.
Okay, and Sue brought up a very valid point. Is it time that we do another survey to see where our folks are in the community and in the classrooms, where they are at as far as moving things forward? Because one of the things that I heard loud and clear from teachers when this came up before the first of the year was stop changing, keep things the way they are. I understand at some point we are going to have to move, but I'm going to really want to see how we are going to be able to keep the level of mitigation when we have, I mean, all you have to just listen to the news. They're saying this is going to get bad again. If we can't get folks vaccinated fast enough, and we don't have enough vaccine, and we have these new variants coming in hot and heavy.
I think that on the survey issue, and sorry, Ms. Franklin, if I may, can I respond to that? Okay, so on that survey issue, I'm fine hearing back from our constituents when we need to, but we have surveyed, I think, enough to get a feel for the lay of the land. And I think that unless there is if we are going to go to taking the step of doing another survey, I don't think we should do it until we have something a little more concrete that we're surveying on, you know, an either or, you know, something, choices or something like that. So, but yeah, you're also bringing up, Ms. Franklin, the point about the health, and I do think that it warrants saying, I mean, that these new strains that are more virulent, that spread more easily when they're here, we're already at a point with the original virus where what the experts are saying is that we should be doubling up masks or using N95 or KN95 masks. We're already at that point, and we haven't even gotten to, where we're being overrun by one of the other strains. So I think what we've done this year, honestly, has been amazing. I know I've been one who has always pushed us to be a little bit more cautious, but nonetheless, we are open. We have a hybrid model. That's something that I believe the CDC and other organizations do recommend. And we've been doing it all year, and we've been doing it well. Like I said, I don't want to shut the door on taking the next step if it's safe to do so. But there are, this health issue and what Ms. Franklin just brought up. To me, this is an ethical and moral issue. That we have these new strains coming. And basically the day after 2 weeks is up from the last time that, most of our people got vaccinated, we're going to fling open the doors. I mean, it seems a little bit premature, I think, and a little bit reckless given what is happening. And one of the things that was said is that the numbers are going down in the right direction. I don't know if they're at the right level. That's something that we don't, we're left to our own to figure out, but certainly there are metrics that we're not quite there yet. I hope they keep going down. I hope these new variants don't spread here. And if that's the case, a month from now or more, then we can reassess. But at some point you have to look at this and go, we're 3/4 of the way through the year. Whatever benefit is going to come from making this change, how much more damage is going to happen from upending people's lives and adding extra risk and so on and so forth. I mean, these are the things that I think we have to really ask ourselves. But that's also why I said, I think that in order to pull something like this off, I think you have to have the support of a significant amount of your community and your staff in order to do it. So I think how we even discuss this and ask the questions and do it is going to be very important.
Does anyone else who hasn't had a chance to speak yet want to speak? If not, we'll move on to our next.
Marty, can I just make one more comment? It's a quick one, promise.
As long as it's something new, because no one else is taking
it's
4
new,
turns.
and it's quick. When we're talking about involving other people in decision making, there's one group that we haven't discussed, and that's the students. So I hope that when we are trying to get feedback, we are also asking students, because I've heard mixed reactions from students as to the idea of going back. I think everyone feels like every student is excited about the idea of getting back into school right away. And that isn't necessarily true. And I think we sometimes forget that the students, they're not all necessarily in a rush to get back. It's going to be a very new experience for some of them who have never been in, for example, a 6th grader who has never been in middle school for a full day. They have never gone through changing classes 8 times in a day. It's all a very new experience to them. And we're just going to open it and we're just going to say, here you go. And that's going to put a lot of pressure also on those teachers who I know what it's like to start school with middle school children who are new to the whole concept. It takes a long time to get them up to speed. So, I mean, I know they've been in the school already, but they haven't been doing an 8-period day. So I think I think we do need to involve students in the thought process also.
Well, I mean, I know students were involved in that first survey. We do have students on the advisory committees that are involved, especially the secondary. I know they're on the secondary advisory committee too. So at the next meeting, we'll bring back our mitigation strategies, and we'll be talking to our health department as well, and working with them on these strategies. I think it's important to include them when making these decisions, and we'll make sure that our health department has approved whatever strategies that we are going to be recommending, and how we will come back. Okay.
Thank you, Dr. Meyer. The next item on our agenda is COVID leave for employees. As was mentioned in the last meeting, COVID leave reimbursement from the federal government ended at the end of 2020, and MCPS has been supplementing that. So may I have a motion to adjust the return to learn plan to discontinue the use of COVID leave for employees on March 24th, 2021.
So move.
Second.
Thank you. Any discussion?
Do we need to make this decision right now? Well, I mean, I guess I would rather not vote on this when I'm not sure where things are going yet right now. And so I think that to make a decision right now and vote on it for something that is almost 2 months away, I think it's a little, I don't feel comfortable with saying that.
Well, again, the federal government ended their
I understand.
reimbursement, so we've been spending this out of our pocket. So unfortunately, they're, as with anything, are always abusers of the policy. So yes, we need to proceed with making this decision now.
Well, let me ask you this. Maybe Mr. Knott can help me understand how we handle the COVID leave right now. Because I'm not really familiar with what it's being used for and how maybe I can't make a decision on something that I'm not really clear on.
So currently we are giving employees leave that is not charged to their sick leave. It's basically free leave if they have an issue with COVID, either personally or within their household. Because if they are a contact, and we certainly don't want them coming in and working. We are also still allowing employees who have some daycare issues, where a daycare or a classroom in a daycare has to shut down and a parent has to stay home with their child, to use this leave as opposed to their personal sick leave. But it's all related to COVID.
So how is it being abused?
Well, we've had some questionable issues or concerns or occurrences brought to us, and the health department does not provide notes saying yes, this person needs to quarantine, or unless they're a positive case. And some doctors' offices as well, especially early on, were not providing doctor's notes as kind of that backup proof to ensure that there was a legitimate need. Now, it hasn't been rampant. There's been a few issues like this, but not rampant. But in our area, most other divisions, if they are when they were following FERCA, if they've extended it, they're extending it. A lot of them are ending it March 1st. And I think part of it was to give their employees the advance notice that this was going to happen, so that hopefully, they may get the shot, the vaccines, and be safer, or may just work to improve their own mitigation. Because what we are seeing is a lot of all of our situations are where they're doing something outside of work that causes them to have to quarantine, and it's not work related.
Danny, do you have a number or how much is this costing us, something per month or per week or something like that?
I do not have that number, but I know that I think our finance department was tracking it, and at one point, especially back in December when we had so many of our employees out, it was substantial what it was costing us.
So, but I would also expect that by March 24th, with what was it, 1,500 vaccinations, that the numbers would fall considerably. Sorry, I'm thinking out loud on this one, because first of all, I trust our people, I trust our teachers. I mean, sure, there's always, I guess in anything, there's going to be maybe things that are questionable or whatever. I don't know, but that's, by and large, I don't view that as a problem. if you have somebody who, I mean, I think the people that are being recommended not to take the vaccine, for example, are people who have a high allergic reaction and that kind of a thing. So, what happens in those situations? I don't want to shut the door on somebody. I don't want to force a teacher who couldn't get vaccinated for some reason or whatever to come in if they're exposed or something like that. So how would we handle that, I guess, come March 24th? Because most people will be vaccinated by then, right?
Yeah, I can tell you how much it would cost. I mean, it's costing us between $3,000 and $7,000 a day. And so you're talking, it's about $25,000 a week, or $20,000 a week, about $80,000 a month that we're having to cover now, that we were not having to cover prior due to the regulations and the money we use. So it's about $80,000 a month.
Is that current statistics, Mark? So that's the past week?
This past week, it's probably costing us about $2,500 a day, which is about $10,000 for this week. That's what it's costing.
And
So,
surrounding school divisions, ended theirs in December.
Yeah,
at the
some
end of
ended
December.
when that FERCA actually stopped.
Right.
And I see a possible teacher morale issue too when, those who've gotten the vaccines and chosen to do it, and then those who choose not to,
Yeah, but if you have children at home with COVID, if you have a child who gets COVID or a husband who gets COVID or family members, that's, that has nothing to do with you getting the vaccine, that you have to take care of them.
Correct. Yeah, I understand that. Basically, we're going back to any type of sick leave. I mean, if a spouse or a child gets sick in any other way, employees have to take their sick time.
So with at the federal level, they're looking at giving more support to pre-K through 12. So that would mean there would possibly be funds that we could receive to help assist when we have these situations. Would that be true? Is that what you were saying? We had other funds?
I don't know. I don't know the funds that were currently released. I don't believe include this. Tommy, is that correct or not?
No, you're correct.
So the funds that ran out the end of 2020, where were those funds from that were helping to support this?
Those came out of school operating funds.
Wait a minute. So
we're being reimbursed through the COVID.
Right. That's what I'm saying. So there could be a possibility that we could get more funding in the future to help support this again. Possibly.
I guess possibly, yeah.
Well, and I would also add that there's been a lot of COVID money that we've also received from, through various sources. Has the last few weeks or months have we blown the budget on that, or did we not budget for that, or what? Because to me, this is a pretty fundamental thing that I think we decided to do early on, and for good reason from a health point of view, right? And I understand some of the concerns, but I also feel like, all the more reason I think that for the small remaining percent of the population of our staff that may not have been able to get the vaccine even, I'm just not comfortable hacking this off.
Okay, I believe it's probably time for a vote then. Ms. Drake, could you do a roll call, please?
Ms. Bond?
Yes.
Mr. Chewbacca?
No.
Ms. Franklin?
Yes.
Ms. Cass?
No.
Ms. Karan?
Yes.
Ms. Parton?
Yes.
Miss Graham,
Yes,
motion carries.
thank you. And the next item on our agenda are the MCPS, SOL, and EOC emergency guidelines. These were presented to you at the last meeting, and at this point, they are ready for a vote from the board. May I have a motion to approve the recommendations for SOL testing for 2020-2021 school year?
So move.
Second.
Thank you. Any discussion?
I have a question. Is Dr. Meyer still here?
Yes.
Not on my screen. Okay, sorry. You weren't on my, you disappeared from my little screen. So.
Okay.
Can you help me? I probably ought to know this, understand this better, but I don't. What is our requirements for taking SOLs during this time period? Has there been any relaxation of guidelines for SOLs?
Yeah, that's pretty much what this is, these emergency guidelines. There's been no relaxation in the actual SOLs that you have to take. There's been a relaxation, for the most part, there's been a relaxation in the score. You know, a passing test score is 400 usually. Also, usually if a kid gets a 375 or above, they can take what's called a retake, or get a locally verified credit. If you're a special education student, you can get 375 on as many as you want. If you're not, then you can get 375 one time, and we can give the locally verified credit. What the state has done is dropped it to 350 for unlimited local verified credits. So as long as the student gets a 350, then they would get the locally verified credit. That is the biggest piece that is in these emergency guidelines.
So we're still required to take them, though.
Yes.
Well,
It's not an
it's only-
option.
Yes.
It's only the minimum that the federal government requires. It's not even all the ones the state requires.
No, actually, that's not true, Marty.
Oh, sorry. Okay.
We have to take all the tests. Yeah, we
Okay.
still have to take all the tests this year. That is proposed legislation, Marty, what you're talking about.
Got
which
it.
That would be wonderful if that passed for the future years. But yeah, we're still having to take all of the test. There's a couple of grades where, you know, in this, they were allowing for us to either take the test or switch to a
substitution kind of.
Yeah, the substitute test, not really a test, but more portfolio driven.
Mhm.
The state didn't tell us that until like right before the holidays, maybe. And so we'd already started teaching classes. So we actually asked our teachers where this was applicable, like civics in 8th grade, for instance. And our teachers chose, let's just take the test. We're already into the class several weeks. It would make no sense to go back and start portfolios now. And so, but basically, since these changes have been made by the state, like the 350, they're asking that school boards approve these emergency guidelines and that you allow our students to also take advantage of these emergency guidelines.
Gotcha. Interesting. They drop SATs, but we still got to take SOLs.
Anyone else have any comments?
Parents can still opt out, all right?
Yeah, you can still opt out of SOLs. You know, if parents would like to opt out, they can opt their children out of SOLs. However, you know, where there is a consequence is at the high school level, because high school SOLs, there to get what's called the verified credit. A verified credit is passing the class and passing the test, and that gets you what's called a verified credit. So, you know, if a high school kid didn't take the test, they would not get that verified credit and would have to come back at a later date and take that SOL test. If an elementary or middle school kid, or unless the middle school kid's taking a high school class, decides not to take an SOL test, there's really no, that's okay. Of course, the state has also dropped this year accreditation for schools. So no school will be held accountable for accreditation this year. We're sort of sad about that in some ways because we think the last 2 years Shawsville Middle School would have been accredited, and they haven't had a chance to show all the great things they're doing out there. So that's our only school that's not accredited anyway. So so that's pretty much all that in a nutshell. Any other questions?
Ms. Drake, could you please do a roll call again, please?
Ms. Bond,
Yes.
Mr. Trebaka,
Yes.
Ms. Franklin,
Yes.
Ms. Cass,
Yes.
Ms. Karan,
Yes.
Ms. Parton,
Yes.
Ms. Graham,
Yes,
motion carries.
thank you.
Yes,
The next item is our MCPS Middle and High School Program of Studies. Dr. Meyer?
Yes, thank you, Ms. Graham. Tonight we're presenting the middle and high school program of studies. I just want to commend Mr. Pauly on working on this. And in these program of studies, the only differences from last year are any significant differences. We've added 3 courses. One is theater art courses that basically we've aligned those with the Virginia Department of Education. Next is the Corps Cadets, year 3. Next year, kids are actually signing up for a 3rd year of that program. And then something exciting that we're adding is welding 3. We used to only offer 2 years of welding. Now we'll be able to offer 3 years of welding. So that's the differences in the actual program. And so these new courses need to be approved by you, so you actually approve the entire program of studies. Just simply because these are just extensions of current offerings, we hope that you'll consider approving this tonight. If you're not ready to approve it, we can approve it at the next meeting. However, we still have to start scheduling kids for next school year immediately. And so in the future, we'll try to get this to you earlier. This year, we had some issues with the Department of Education. They slowed us down due to some course numbers and codes that we needed to add, and they were difficult to communicate with. And so, but if you feel okay approving it tonight, we'd appreciate it. If not, we'll call it a draft, but we're still going to start signing kids up this coming week for classes for next school year.
May I have a motion to approve the middle and high school programs of studies as presented?
So
So
moved.
moved. Second.
So
Any discussion?
I'd like to have an opportunity to look through it and not have to vote on it this evening. I understand that you need to get it done and get it out, but I mean, it would be nice to have a little bit more time to really absorb it.
Anyone else have any?
So, yeah, I think before we started voting on it, we needed to make sure that everyone was okay to move forward on the first reading.
Okay, so I guess I'm hearing, do you all want to vote on it tonight or next time?
Right now, we have a motion on the table to approve the program of studies. Whoever made the motion would need to rescind that, and we would essentially have to vote to either move forward with it as is tonight or table it for the next meeting.
Well, there wasn't time given before there was a call for a motion for us to have that discussion. Whether we wanted to move it tonight or wait.
I feel like we're rushing motions out pretty quickly this evening to vote on things before we even have an opportunity to absorb what the question even is.
So normally, since we're in discussion, I guess normally I would agree, and I can still go that way if there's enough support for it, and I can rescind my motion. But I think in this case, given the relatively small number of changes, since we did review it last year, and given, I think that it's highly unlikely that anything would change. That I'm okay moving forward, but it's again the will of the board. And
For the same reason, I'm okay to move forward because only addition is really three courses from the last year. So
I agree.
Yeah.
I agree.
And yeah, and I'm okay with moving forward because of the small changes, but I just still think it's important that we do things in the prescription they should be, but understanding the difficulties working with the state to make sure everything was going to be done to their level, I'm okay with moving forward with it.
Okay, since we have a motion and a second, Ms. Drake, could we have a roll call, please?
Ms. Bond,
Yes.
Mr. Trabaka,
Yes.
Ms. Franklin,
Yes.
Ms. Cass,
I'm going to say no, but I'd like to qualify it with the fact that I do not like to make decisions on things I haven't had an opportunity to really review.
Ms. Kadan,
yes.
Ms. Parton,
Yes.
Ms. Graham,
Yes,
motion carries.
thank you.
All right, next, thank you all. Next, bylaws for Gifted Advisory Committee. The administration has provided the Gifted Advisory Committee bylaw revisions for review as requested. The revisions have been reviewed by the chair of the Gifted Advisory Committee. The board reviewed the bylaws in January and is asked to approve them tonight.
May I have a motion to approve the bylaws for the Gifted Advisory Committee as presented?
So moved.
Second,
Thank you. Any discussion?
So I thought we received some communication that there was still an issue around clarity, or did I see an old email? I'm not sure.
Annie?
Yeah. And the concern that was raised that you're speaking about is I've been getting quite a few questions about the processes. And so, we spent quite a bit of time meeting about the committee being an extension of this committee. And so when you all voted to determine whether they would report to you or whether they would report to the superintendent, when that decision is made that the committee reports to the school board, they are then an extension of the school board. And so then the actions need to be in line with the school board, such as how the meetings are run, when public is allowed to speak, all of those pieces. And so there has been some ongoing questioning from the chair of the committee as to why that's required. Why do they have to do that? Where is it specifically in law that is a piece that's required? I feel like after maybe our last conversation today, I just I don't know how to more clearly communicate, to provide this piece of law that says that they are a committee of the school board, and then that we have school board policies in place which speak to what the school board does, therefore they need to do. So I'm just going to continue to work with the chair in that way. But in terms of the bylaws are in place. I think it's just an understanding of how those meetings are run and what the role of that committee is in terms of, the advisory members are the advisory members. If they're going to hear from the public, then they hear from the public, but it's very similar to the way this board functions. You just listen. It's not a back and forth or at any time during a meeting.
Okay, thank you.
Okay. I'm sorry, Ms. Drake, do we have a roll call on this, or are we waiting for that?
I thought roll calls for our votes tonight might be easiest. It's hard for me to catch everyone's voices.
Sure, that sounds great.
If
Was there
there is-
anybody else that had any questions or concerns? Okay, then proceed with a roll call, please.
Thank you. Ms. Bond,
Yes.
Mr. Trabaka,
Yes.
Ms. Franklin,
Yes.
Ms. Cass,
Yes.
Ms. Karan,
yes.
Ms. Parton,
Yes.
Ms. Graham,
Yes,
motion carries.
thank you.
All right, thanks. Next is the 2020-2021 supplemental appropriation. The supplemental appropriation requires that we ask the board of supervisors to approve CARES funds, grants, and other unanticipated revenue for MCPS. We're asking you to approve this appropriation request tonight. This request is required so that we can spend the funds that have been received. Mr. Kranz can answer any questions regarding these.
Thank you. May I have a motion to authorize a request to the Board of Supervisors for a supplemental appropriation to the 2020-2021 school operating budget in the total amount of $837,375.
So moved.
Second.
Thank you. Any discussion? Okay, Ms. Drake, could you proceed with a roll call, please?
Miss Bond,
Yes.
Mr. Chewbacca,
Yes.
Miss Franklin,
Yes.
Miss Cass,
Yes.
Miss Karan,
Yes.
Miss Parton,
Yes.
Miss Graham.
Yes,
Motion carries.
thank you.
And since we're talking about funding, one thing that I wanted to let you all know that we were told by the county that they'll be sending the remainder of our money that they've held back this year next week. So that's good. So, yep. All right.
Thank you. And we requested that back in October, November.
Something like that.
Yeah. Okay. Thank you. The next item is unfinished business. Does anyone have any matters of unfinished business? Okay. The next item is new business. Are there any matters of new business? Okay. The next item is announcements. Does anyone have any announcements? Okay.
Well,
I'm
I
sorry.
do. So I'll remind folks about the Dialogue on Race Winter Summit on the 13th. Please register. Should be some really good information.
Great, thank you. And then everyone can see the upcoming school board meetings and the items that will be on those meetings. We are waiting on the Board of Supervisors to confirm the March 16th joint session. So that will show up on the list once that's confirmed.
So with that item, Marty, should we not also put out there that the 15th was the date that they were thinking we were going to do it? So it could be the 15th possibly, if that works for us. Excuse me.
Right, it could be either the 15th or 16th. I think, Penny, we were hoping that at least Craig sounded very positive that they would be able to do the 16th because it was going to be a work session for them as well.
Well, the 15th was going to be their work session. So I know we're hoping for the 5th or the 16th,
Right.
but we haven't heard back. It could end up, we may need to look at the 15th. I think we should
Sure.
just let folks know that.
True. It could be either one of those. And as soon as we know more, we will let you know. The next item on the agenda is closed session. Do I have a motion to
Yeah.
go into closed session?
Well, hold on one second. Don't,
Okay.
I'm sorry, Ms. Graham. Closed session is regarding personnel matters, and all that we have on that is the personnel report. I have nothing specific to report to you in regards to the personnel report. So I'll leave it up to you. If any of you all have questions regarding the personnel report, then we will need to go in closed sessions. If you do not have any questions regarding the personnel report, then we do not need to go into closed session. So I guess we need to ask that question first.
Okay. Does anyone have any? Go ahead, Ms. Franklin.
No, I was going to say I have no questions.
Good. Does anyone have any questions that we would need to go into closed session for on the personnel report? Shake your head. No? Good. Oh, man, that worked great.
But that hurt.
All right, then, hold on. Do I have a motion to adopt the personnel report?
So moved.
Second.
Any discussion? All those in favor say aye.
Aye.
Any opposed? All right, then I adjourn the meeting at 9:04 p.m.
Wow.
Good night.
Really? We're done?
We are not going to know what to do with our time now.
Wow.
Thank you, everybody. Great meeting.
Good night.
Good night, all.
Warm.